Five signs of stroke that you should watch out for. Now, stroke can happen suddenly, and in most cases, you'll be the only person there to see the person from dying. Now, one of the signs of stroke is facial dropping. Now, this one child your face becomes weak, numb, or the person cannot actually feel anything, they can that part of the face. And it becomes more evident when you ask the patient to smile. So when you ask them to smile, most times see that one part of the face will move while the other part will not move. So that moment you have to act fast and take the patient to the hospital immediately. Another sign is arm weakness. Now, there's this sudden weakness of the arm. Can happen either both arm or one of the arms. The arm becomes weak, numb, and the person is able to move the arm. Most times we ask them to raise their arms up, you notice that one part of it is weak. Now, as I said, stroke is an emergency. Take the person to the hospital immediately. Another one is slurred speech. Notice that the person can no longer talk very well again, or even if he's talking, the person is acting confused, or he can't even make speech at all. Now, in this case again, these are signs of stroke. You have to be very fast and move the patient to the hospital immediately. The fourth one is visual problem. Now, they may start having either they lose their vision or starting seeing double vision or not be able to see clearly, especially one part of the eye. Although it can occur in the two, this is sign of stroke, so you move the patient to the hospital immediately. The fifth one is sudden severe headache. Now, you start complaining of sudden severe headache, so they'll start feeling dizzy, some can even become unconscious, or that the person cannot walk again, another complaint of this severe headache. So please move the patient to the hospital immediately. Now, most people that are prone to stroke are those that are elderly and those that are hypertensive, or people that actually stay in the place for a very long time and don't do physical activities. So put special care and attention to these people to avoid problems. This acronym I want you to remember in your head, anywhere you go to remember it. It is be fast. Be fast. That is B-E-B, then fast, F-A-S-T. The B stands for balance, the E stands for eyes, the F stands for face, the A stands for arm, the S is for speech, and the T is for time. So in the stroke patient, time is very, very important. I'll put the acronym on the screen for you to know and remember all this. Thank you.